The World Health Organization says there have been unprecedented progress since 1990 in improving global health outcomes, thanks in part to the priority given to the health community in the Millennium Development Goals, rather. However, progress in achieving the MDGs has been uneven, with the poorest and most marginalized people still being denied the most basic health services. The WHO says the quantity, skills, and geographic distribution of the health workforce have been recognized as factors that have held back even greater and more equitable progress on the health-related MDGs. Experts say more needs to be done to ensure that health workers in low-income countries receive the training and support they need if the world aims to reach the health targets of the post-2015 United Nations Development Agenda. Joining me for more on the subject is Dr. Mphuru, Tanzania Country Director with IntraHealth International, a global health organization dedicated to improving the performance of health workers and strengthening health systems. Dr. Mphuru, welcome to the show.
Great to be here.
It's good to have you. Listen, I was just in Toronto attending a midwives conference, and I spoke to many of the participants. One of the issues they kept talking about is training and the need for recognitions. And when I heard that and I look at what is happening today, it seems like these issues is across the board when it comes to the health workforce. And this is an issue that you address. Tell us about this situation.
Thank you. To tell you the truth, there has been a shortage of healthcare workers globally. WHO estimates that there's a shortage of about 9 million health workers globally, and if nothing is being done, it will double to 18 million by the year 2030.
That's a serious problem when we see, especially in places, rural communities where, you know, you don't find that many health workers.
It's true. At the moment, there is an equal distribution of health workers. Even those who are available, they are not equally distributed. There are issues around not only that there is not enough health workers in country, but those who are also available, they are not equally distributed. We need to start investing in health workers. We need to make sure that we have fit for purpose and fit for practice health workers. No health workers, it means no health services. The government and the leaders have to invest more on health workers and make sure that we train the health workers, we provide them with support, we give them mentorship, we supervise them, and we have to make sure that going forward we invest more on building a resilient and a sustainable health workforce to be able to reach the goals which we have been looking forward to reach, like the SDG goals or the maternal and child mortality rate goals, which the reduction we want to reach.
We saw some progress with regards to the MDGs in some areas such as maternal and child death. There has been a reduction. But it seems like when we talk about addressing global health, a lot of emphasis is put on service delivery as opposed to training or even the workforce as we're talking about. Now, tell us about the work that you do and how, through the organization or IntraHealth, you are addressing this issue.
Oh, thank you. IntraHealth is a champion of health workers. We have spending a couple of years focusing mainly on healthcare workers. We work with the governments to make sure that they have health workers who are ready, who are trained, and who are supported to provide services at the high qualities in the country we are working. We have been focusing mainly on not only helping the government with the production of health workers, but working through the retention strategies. We have health workers, but they need to be fairly compensated. We need to make sure that they are motivated to do their work. We need to make sure that their performance is enhanced through either training, to make sure that the pre-service trainings, any gap which is existing on pre-service training, we work with the government to make sure that we are able to provide technical assistance on that. We are doing in-service training to make sure that we have competent health workers. We work with the government to develop mentorship programs, and we want to make sure also those health workers are coached and are equally distributed using the tools which are evidence-based tools.
Very nice. Well, thank you so much. We know that you're here to advocate about this and other issues, and good luck during your time here in Washington.
Thank you so much. Appreciate it.
And that was Dr. Mphuru. She's Tanzania's Country Director with IntraHealth International.